have the successful candidates. Dr. Paramveer I have personally given him
Yes, we
one-on-one
are live, ma'am.
counseling.
We
We are
can
live. We are
start
live.
running.
Okay.
Thank you. Good afternoon, everyone. I am Dr. Snigdha Sharma, academic head from
इंस्टाग्राम पे
Academically.
स्टोरी लगा
And
सकते हैं क्या
today
लाइव की?
with us, we have recent
नहीं
qualified
हम इंस्टाग्राम पे
AMC
लाइव क्यों नहीं गए?
doctors. They got the result yesterday, and we are very happy to do this live interview for all of you.
दैट वे लाइव नहीं
With
इंस्टाग्राम पे भी तो
us,
लाइव होना था.
today we have our CEO, Dr. Akram Ahmad, whose
नहीं
brainchild,
इसको
this
भी करना था लाइव नहीं हुई
academically
थी तो
has
होना चाहिए था.
given us this platform to get all of us together. And today we have been able to help so many doctors qualify this exam. Dr. Akram, over to you.
Yeah,
शुरू में देख
thank
तो
you
बीच
so
में
much,
देख
Dr.
कितना बड़े थे
Sunita.
मोटे वो
So
मोटे.
I really feel, good when the doctor passed this exam. So when I was in Sydney, so I met hundreds of students, right?
तो मैं तो स्मार्ट हूँ ना तू देख
And
मेरे
initially we
थोड़ी
started academically with the pharmacy student,
बेल्ट भी
but
नहीं
I
लगा के
got
आया.
a lot of inquiries from medical doctors. You know.
क्या?
So initially, then we immediately
स्मार्ट
started,
ऊपर से
the
बोलता रहती है.
AMC exam. And luckily we got after our first faculty, Dr. Satul Sharma. And she was living in Sydney near to my home basically, and Dr. Udara also is very very near to my home. So we start from there, very few students, I think 5 7 students from in my first batch, and today we have lot of students pass, and I feel the proud when the student pass and they meet me in Sydney because I passed the exam and I got the job. I'm here, I'm working here, I'm here and there. So really, congratulations to you all, basically, to everyone.
So, sir, today we have with us Dr. Lim, Dr. Maria, Dr. Arshia, Dr. Deepika, and Dr. Paramveer. They all have very unique stories. So,
Okay.
I would like to begin with Dr. Arshia, who was the first person I interviewed today. And she told me her journey, which was
Hmm.
quite, I would say, difficult for her. Arshia, Dr. Arshia, I would like for you to tell, sir, how,
Okay. Yeah. Can I start?
yes,
Yes,
please.
yes.
Yeah. Okay. Actually, I finished my internship in 2024 April. So then I was preparing for my Indian exams. I gave my INSET in November. Actually, mine was the first batch in my college to get graduated. So my college wasn't listed in the AMC list. So the procedure was taking time. At the end of the December, my college was listed in the AMC World Directory of Medical in that list. So after that, in January, I was researching about the resources regarding AMC preparation and all. Then I came to know about academically. Then I started my preparation from February 1st, I think. Yeah, then in 4 months, I completed all the video lectures and everything which are available on the app, and I was simultaneously giving the what I say the questions and the portal which was given to us in the app itself. Then I think my degree verification, it took a long, like nearly 3 to 3.5 months time. So I got a mail at the end of March, I think March 28th, that the degree was sent for verification, and it took almost like 3 to 3.5 months. At the I think in the middle of July, I got my degree verified. Then I took 2 months time prior to my exam so that I can revise and recall everything what I have read in the past 5 to 6 months. Then I booked my exam on October 9, and luckily and also with my hard work, I cleared my exam in my first attempt. Yeah, that's it.
So, Dr. Arshia, thank you for
Yeah.
that. So, Dr. Akram, with your permission, I would like to ask them a few questions about the study
Yes,
strategies.
yes, yes, please.
So, doctors, you all have faced, like today, this cohort of students that we have, all the doctors who have cleared, and especially the students who are looking or listening to this live video, the most important question that comes, if you're working, how do you divide your study hours and your work hours? Number one. And if you're not working and you are a fresher, then how do you give importance to the clinicals and how do you look up at it while you are studying? Because today we have people who have a lot of experience of work, like Dr. Lim, And we have freshers like Dr. Deepika, Dr. Arshia, and plus Dr. Paramveer and Dr. Maria. So, who would like to take this question first? Dr. Lim?
Okay, sure. So actually, I'm currently working as a general practitioner, and on top of that, actually, I'm preparing for my MC. So actually, I have signed up the academy for almost a year from now, but I've done my intensive study or preparation for almost 6 months. So actually, I passed on my second attempt, while in the meanwhile, I'm studying and also working at the same time. So actually, for time location is very important. So usually I work on weekdays from 9 to 5, and other than that, at night I will try to take about 2 hours to study. And on weekdays, if I'm not working, then I will try to study for at least 3 to 4 hours. But after that, I already assigned allocated the time for my AMC exam. So I took a 2 weeks hold off to really focus on my preparation. Yeah.
Okay. Thank you, Dr. Lim, for that question. Anyone else would like to address this question? Because we have a lot of queries coming from students about this. How do we balance work and studies, or if not working for freshers, that clinical knowledge, the base that clinical knowledge gives you by working? If you don't have that thing, how do you concentrate while doing clinicals? How do you think of yourself in that clinical scenario? Dr. Deepika, Dr. Paramveer, Dr. Maria, anyone?
Uh, uh,
Yes.
Good afternoon. I'm Deepika, and to be honest, Dr. Len was my motivation actually. I used to see her scoreboard results in the app, and her name used to be the first one, like Dr. Len. And I'm sorry, I can't pronounce the name. So I keep that as my motivation, and I'd be like, okay, like, see, students are studying this much hard, and where am I? I'm in the rank 5, rank 8, and I used to push myself, okay, let me, score at least, under 5 or something. And I thought like Dr. Lin was a guy, and because I'm not familiar with the name, so, and now it's good to see you, Dr. Lin. Hello. So you are my motivation. Thank you. She used to be in the first list, like Dr. Lin, rank 1, always. So,
Oh,
uh, so good to see you. So, as Dr. Sagna said, I'm a fresher and I'm not working right now. I recently graduated and completed my F1G exam in my first attempt, and then joined internship in Maharashtra. And then after my internship got completed, I started my preparation in July, and that's how. I used to study before, like on and off. I used to see videos and everything, but I was not, completely focused. So
okay.
90 days was my time period, and I sat down, consistency, everything was there, and yeah, that's
So,
all.
but like you only did your internship, right? Someone with more than, you can't compare the experience that someone for more than 1 year has. That gives you a base of clinical knowledge when you're thinking of yourself in a clinical
भाई एक
scenario.
मिनट
How do you overcome
दीपिका
that thing, the extra knowledge that clinicians have from
क्या
working for so many years? How do you overcome that challenge?
So to be honest, I
डॉक्टर
just
सिंह भी तो
studied whatever academically gave me the PDF and everything. That was my only source. And apart from that, some links that was provided by academically in the PDF, the therapeutic
साउथ
guidelines, the
इंडियन
RACCP, CGP guidelines. That was my only source. And apart from that, I didn't go through much extra. Subjects or anything. I didn't study anything, any of that sort. So my only source, my main source, and I kept revising. I did 4 revisions before my exam, and I solved almost all the questions from academically and also from mathematics. I said in the interview earlier.
Yes.
Uh,
Okay.
yeah.
So, what is your take, Dr. Maria and Dr. Paramveer, with this? Dr. Maria, please first.
Yeah, uh, it has been like more than 9 years that I has passed. So, like balancing the clinics, uh, family, and studying everything was little bit difficult. Um, but I tried to finish the classes at least like within 2 or 3 days. Uh, once the class is
ये
done,
तो ऐसे ही करती है
and try to finish the mocks also. Okay, so the mocks really help, like where we stand we can understand that from the mocks. So and the classes were
बिग
excellent,
बॉस देखते हो आप
because they really help me to like brush up my concepts. And uh, actually in May I gave a first attempt, and I lost for 2 marks. So like, and for the last one month and 1.5 months, I was like, I quit my clinics and I was just preparing for the exam.
Okay.
And um, otherwise it was like a 4 or 5 years study, if at all possible. Minimum of 3 years I tried to manage
Mm.
every day from my starting of my coaching.
Okay. Okay. Thank you for that, Dr. Maria. Balancing family, I would say for females, especially if you're married with kids working, it gets quite tricky. Coming from me, like I personally, with my kids and the work, I wouldn't be
मैं
able
जब
to take
निकने
up
से
an
पहले एक
exam.
बार मिला हूँ
The level of
दिल्ली में आई थी
concentration that needs.
Yeah, it's really difficult.
Yes. So now I'll come to Dr. Paramveer. I've already talked to him in a one-on-one mentoring session sometime back. So I know him a bit more than all of you because of that reason. So
सही
Dr.
है भाई
Paramveer,
हॉस्पिटैलिटी
what's your
में
take on
अच्छा आ गया
this?
लॉग आउट
Yes, ma'am. So actually, this was my second attempt only.
आज करेंगे तो
In the first one,
10 से
I'm not
4
going to
बजे
lie, but I was a little bit overconfident. That's why I didn't pass, maybe. But the main thing that I got
वर्क
it
लाइफ
from
बैलेंस
got from it is like we have to study whenever we get the time. It's not
Mm,
about like you have to need something like a good study
Correct.
table, good books lying around, and like you have to study, then only you will study. That is not the case here. We know we are working together in this thing, and with the work, we have to manage the study part also. So actually, whenever I get the time, whenever there is a free shift or like there are less patients around, so I'll open up the book and
मैं हुडी पहन के आया
study for it. So in the second attempt, what I realized was that
नीचे उतरी हुई थी अभी
the questions, the practice that you do
मैं बहुत
about the concepts that you have
ये
learned,
होती है
that is the main thing in this thing, because it is very much a little bit
मेरे को आज
different
शेप
from the
शेप
practice
गिव
that
करने
we
की
do
बोली
in
थी
our own country other than the Australia, right? There are the guidelines are different. They
yes,
follow a particular protocol, and we have to know every step of it. That is
yes.
the main thing that is difference. And so that's kept
किसी
me
ने एफआईआर दी क्या
motivating my friends and family all over there.
Oh,
So that's the reason
किसी
like
को भाई
I
वो
got a like 50
उससे
mark
अच्छा है
difference in my
मैथ
attempt.
तक शो
oh,
Uh,
that's a huge one.
Yes. Like
That's a huge one.
I scored 280. So in the previous I got like 230 around. So it was a 50 marks difference around.
Okay.
So it all pays at the end.
It does. So I just thought of a rapid fire round because I realize AMC also gives you only two options out of which you have to choose one, right? So I'm going to do a rapid fire quiz. You all please unmute yourself. I'm going to ask a question and there are going to be two options. You just have to shout the
मिश को
option
देखो
you
मिश को
choose. Okay, either you can say it loud or you can just use one or
कौन आ गया
two, right? So a sample question. I like to study at night. I like to study in the morning. So if someone likes to study at night, they choose one. If they like to study in the morning, they choose two. So like Dr. Deepika, I can't see both your fingers if you're yes. Okay.
He
Okay.
must be joining on the mobile phone. Yeah.
yeah.
So we'll quickly do a few questions. Okay, then let's do this question again. I prefer to study at night or morning. Oh.
All are early risers. Okay, it's a 50-50.
Nice. Okay. MCQs or book study?
MCQs.
MCQ. Oh, we have someone with book studies. Nice. Live lectures or recorded lectures? You had a study group or you did it alone? Oh, okay. Only Paramveer had a study group, I guess. Okay. Discord or WhatsApp?
What's
Okay, no one likes
I see.
Discord.
Yeah.
Academically or academically? Okay, so this was just for fun to make this whole day a bit joyful. And I hope that this journey and the strategies that you guys have talked about, where most of the people struggle, how to balance, how many hours to put. At the end of the day, what I have deduced from all of your reviews is that you have to know where you stand and then decide how many hours you need to reach that goal. With that, I would like to ask Bharti if she would ask some generalized questions because I asked you so many difficult questions which came from students. Bharti has those questions which might sound like they're very easy, but she keeps getting them every day. So, Bharti, why don't
Yeah.
you ask a few fun questions?
Yeah, yeah. So the very first call, whenever I I must have connected with all of you over my welcome call. So the very common question that we receive, and I personally receive, did you guys prepare your own handwritten notes?
Yes, I did.
So all of you, or is it like someone? Yeah, Dr. Deepika, for you. I didn't prepare my own handwritten notes. So how did you manage? For the PDFs, and I also made the separate note where mention all the important points. So that was my last minute revision notebook. That was my golden book. You have created one, last minute revision you have prepared. Yeah. And rest my PPT. Handwritten notes. No, I didn't write everything. I just wrote. In my third revision, I wrote that, and I used it for my fourth and the last minute, the last day. That's it. Yeah. So here I don't mean that you need to like handwritten, but definitely you can create a PDF or something because everyone has to create their own stuff. No, that's what we believe. But initially, when the student joined, they just feel like, oh my God, this is so much. I cannot create my own notes. So we need something. So this is my question. Like you have prepared something of your own, huh? Like you just take out some PDF material and something from your earlier content and all. So, what about you, Dr. Arshia and Dr. Maria, Dr. Lynn? How did you prepare?
Yeah, actually, during the first revision, I think it's very quite difficult for the beginners to make a short summarized notes because we don't know what is important and what is not. As eventually we pass during this journey, we get to know that this is the important thing, and during the past recalls, we get to know the important topics. From that, we can collectively we can make the notes. I think during the reading, like in the second revision or third, we can summarize and make the concise note, according to me. Yeah, I think so.
Right. So you do have something that is special for the
Yeah.
last minute watch or something like that.
Yeah, actually, I haven't prepared the notes for every small topic. I collectively selected some important topics and the difficult ones which I felt difficult and which I thought it should be revised before my exam. So for that topics only I made my notes. Rest I studied from the PDF itself. Yeah.
Great. So, but that was the only source.
Yeah.
Dr. Maria?
So what I did was like I tried to hear the lecture twice, and I did the mocks, and while doing the mocks, like the explanations which they are given, okay, then we understand. Okay, the question is the examiner is thinking like this, and I made notes for my own notes mainly for most of the mocks, so that what it was easy for me, like in the last day, like going through that one book made me easy to go through all the books in the academically.
Right, right. So that's the main reason, like at the last moment, you cannot search for multiple books.
Yeah.
So you have one place where you can just look for all that you wish to revise at the last moment. So
Yes.
Dr. Lin, and even I must say that I was quite sure that she must have cleared the exam. And yesterday I couldn't connect with her because of the time zone and all. So Dr. Snigdha asked me how many students have cleared and all. So I said I am sure that Dr. Lin must have been cleared, but she is not approachable right now. And then
She
she
did
texted me
say
back.
that. She did say that. That was the first thing. Even initially, she was like, I know she would have cleared it. I will connect with her in the
So
meanwhile.
I was kind of, vouching that, okay, this student I know must have cleared. So you are very right, Dr. Deepika, that she was a performer before as well. So Dr. Lin, what was your strategy? Like, did you have your own notes or you just rely on the PDFs?
Yeah, actually, same goes to me. I do have my own written notes as well. So usually I will listen to the online lecture once, and then
Yeah.
if possible, I will repeat with the recorder. So from there, I will find out what topic actually I'm lacking of or I need improvement. So from there, I will make my own notes and study further, and in line also with the RSCPG as well. So from the
Yeah.
last 2 weeks prior to the exam, I will just revise on especially the higher questions and then on my own notes. Anything missing, I will try to find out further from there.
That's amazing. And Dr. Paramveer?
I think we have just 1 second, Dr. Paramveer, if you don't mind, let's give you this question because we have this coming from the live comment section. If you could help, students are asking about how to improve your CV, especially for the ones who have a clinical gap.
CV.
Yes.
So I think so, like being associated with a good clinic or a practice, maybe help fill the gap, or maybe you can reach out to assistant professors or professors for your publications and everything. So you can show that I was working on this publication while I was away, or like while I was away from the hospital or clinic. So you can show that you were working on a paper or a project or a report, something like that. So I think so that can be considered a leeway for that thing, a gap in the CV.
Anything that anyone would like to add? Dr. Lynn, Dr. Maria, Dr. Deepika, Dr. Arshia?
So they will work on it. Like now, they will be after clearing part one. This pictures will start like for the CV and all. So this is it.
Another very common Bharti that you have been asking me, we have a question about
Yeah,
CPDs,
yeah,
right?
yeah. So to do yeah CPD activities. Have you been to like you guys have completed your ALS, BLS, and the other activities?
Not yet.
Not yet. So now after the session, because we are going to provide you the post selection sessions very soon, and there we will be briefing you about the details that you need to figure out. I mean, you need to focus upon. And one more question that I am receiving so much, and I would love to hear from all of you, just in a single word only. Like, what were your scores? I mean, the percentage in the subject wise or the mocks that we are providing you before you decide that, okay, now it's the time to book my exam, although we help you with the other things also, I mean the other papers and all. But yes, because student need, I mean they kind of confuse whether they are fully ready or not. So if in I ask you in the form of percentage, what was the average percentage you were scoring in the mocks or the questions whichever you are doing? So we'll start from Dr. Paramveer. What was
Yeah.
your average
Uh,
percentage?
it's actually on the mocks that academically provided and the adaptive quiz also. So in that, in the first mock that before starting the preparation, like in the orientation session, maybe ma'am only told that you should first give an exam and look where you stand.
Yeah,
So I gave that and I was like around on the 40 or 50% line only before my preparation I started. Then
right, right.
yeah, after that, once I have gone through all the concepts and everything and solved some of the questions, then I started giving another mock. Then like it rose to 50 from 60, then from 65, and the last adaptive and the mock test that I gave, I scored around 70 to 75 in between. So I thought
That's
that
a decent score.
that must be like a good. And I also asked Bharti ma'am also like if this score is good or not. So she had like good, it's enough, like yeah, we can carry out the exam process.
Yeah, that's the motivation part that I can help you guys.
Yes.
Otherwise, so nothing. Then Dr. Deepika, what about you? And I remember she was also very inquisitive. She used to bring a lot of questions, and I'm really proud that she has cleared the exam. And again, for you also, Dr. Deepika, I was pretty sure.
Actually, I mean, I'm not the right person to ask this question because I didn't, write any mock or anything before I booked my exam. I booked my exam and then I started my preparation. So, yeah, in my adaptive test, I scored 399, which was conducted by Academically. And the other mocks, self-assessment and all, I scored somewhere 70-80% but I felt like almost all the questions were repeated from the subject-wise mock. So I felt like I know I have to score 100 out. I mean 500 out of 500 in this. If I don't score that much, good for nothing. That's what
Yeah,
my reply was to Dr. I mean Bharati ma'am. So I was like, these questions are super easy. Like we already solved it in
yeah.
subject-wise.
She was asking for more questions. From
Yeah,
there, I can get more questions.
yeah.
I'm
With
done
total
with this.
400 questions, I felt like
Yeah,
I still need more for my
I
confidence.
know.
Okay.
And Dr. Arshia and Dr. Maria, how about you? What were your score percentage?
Yeah, mine was also like about above 60%, I think, ma'am. I need to varied in some around 65, 70, 75, but it was like in some I got maybe above 50 also, but
Mhm.
average was above 60%. Yeah.
60 or 70, we can say.
Seven.
Same for you,
Yeah.
Dr. Maria?
I think so. Okay. Her network froze, I think.
Yeah, some network issue. So on an average, if you're scoring 70% or above, you have a fair chance. And obviously, the last minute preparations, they just add up to your
Yeah.
selection, probability and all.
सर के
So
पास ही
that's amazing. That's nice. So
So
this was it from,
Bharti, don't say this was it. I have one last question before we end today's session. We
yeah.
all know that Bharti has been that bridge between academically and all the doctors, right? So, what is the one best or the funniest? You can use either the one best thing that you liked about Bharti or the funniest thing she would have told you that made you laugh the whole day.
Huh,
Any
I would love to hear that.
any memory with Bharti or even academically that you would like.
Yeah,
Dr.
I think.
Paramveer also said, Faiz, that is coming from our back end support right now. He was the person who got Paramveer here, right, Paramveer?
Exactly, ma'am. So it was like last year, September. Dr. Akram was holding conferences all around the country.
Yeah.
So in Chandigarh, he has, I remember like on 8th of September last year was the conference, and I didn't know anything about the exam or the stuff that goes into it. So I was enlightened there, and Fez was there. He was supportive. He told me everything that could happen that we have to do. So he helped me, and at the spot only I enrolled for the course on the in the conference only, and throughout that the joining process was really fast. It was convenient, not many much hiccups or anything. And as soon as I joined, Bharti ma'am was there on the call.
That's the best thing, right?
The
You
So,
can
main,
say
the
that.
main very good thing about ma'am is like she's prompt. You send her a query or anything, and she's like, yes on it.
Yeah, I think I should have chosen some other career because this is a very common feedback about me. I mean, what should
कोकोआ
I do? I mean, to get this thing more,
कोकोआ कोकोआ
because I'm really thank you for this thing.
so I would
But I
ask.
feel like this.
फेमिनिन
So, Dr. Lim, your memory during this journey with academically, any one quick memory through this process?
So actually, the moment I signed up for Academically, I straight away received a call from them. Yeah. So she directly briefed me through WhatsApp regarding what to do and how to use the platform and all that. So yeah, usually I will receive a lot of WhatsApp from the changes of the lectures and then to remind us to join now and then remind once or
ऐसे
twice.
नहीं उठता है
Yeah, and also all the motivation that she sent through the WhatsApp every day, almost every day before the
Yes. That feels good in the morning, right?
yeah.
Yeah. So, Dr. Arshia, memory, any memory, not specifically for Bharti, any memory through your journey with academically.
Yeah. I would want to describe the whole team in one word, that the team is so supportive and caring from the beginning of our journey to the end. They have helped us in many ways, everything which is required to pass our exam. Yeah.
Thank you so much, Dr. Arshia.
Yeah. Thank you.
Dr. Deepika.
Ma'am, Bharti ma'am was like, a big backbone, I would say. Anytime I message her, she would reply instant. I get instant replies. So I really liked about it. I mean, that made me trust academically more, I would say. And yeah.
Oh, but it's the team actually. I just gather information from here and there and just pour in there.
Even
So
in my
it's
last moment, like I gave my exam on October 10, and I was like panicking. I was like asking. She was immediately sending all the recalls from the students who wrote the exams already. So that was really helpful, and I got almost all the recalls that ma'am sent me. So it was really helpful for me.
Okay, so now we have Dr. Maria, who missed a bit of the conversation. So, Dr. Maria, any one memory throughout your journey from starting with AMC to ending this with academically that you would like to mention here? Or maybe with Bharti?
सबसे बेकार यही है
You
डिग्रेड
are
होता
you're
actually
जाएगा
on
कि हम
mute.
पहले से
Yes. Regarding the mocks and everything, like I was very happy with the mocks actually. It really helped. And
मैंने
Bharati
सुबह से
ma'am
लगाई
was
हुई है मेरे
actually in between
को। हाँ, देखो
checking, and the May
श्री
also, like I got
श्रियम
really,
ही तो कहता हूँ, श्रियम।
even though the marks was good, I felt like I did well. But and especially she was sending recalls, and for this exam, like my exam was on Saturday, and from the first
क्या
day
चीज़
onwards,
थी?
like every day
क्या
sending
चीज़ थी?
recalls. More like I think I got really 10 to 15 questions from the recalls.
Okay.
So,
Yeah.
and it really helped me well. Also, like while seeing the questions, that it actually it calmed me a little bit in between the exam.
Okay, that's so great to hear, Bharti. The
Thank you
best.
all of you, and many congratulations again from the bottom of my heart,
सही है
because
भाई,
you
गजब
know
है।
you guys have made my day. I can say that, and this is the only motive.
Experience
Like
नहीं है।
if any effort of mine or anyone can just change something, so it's a purpose now. Thank you.
Thank you, doctors, that you took out so much time from your day and from your celebration. This is a big day
Yes.
for all of you, a big
इससे भी नहीं
moment
है
to
रिजल्ट तो।
celebrate. You have cleared the AMC exam.
इतने से
Thank you
5
for
देना
taking
चाहिए।
out time, and I hope the interviews and the time you guys have taken out throughout the day would help guide a
5
lot
में
of
क्या ही है,
students, especially for the
इसका तो
November
मिनिमम
session,
चाहिए थोड़ी ना।
which usually sees the maximum
थोड़ा सा तो
influx of
हार्ड ही चलेगा।
students, IMGs, not just Indians, everywhere, taking the exam.
Yeah.
With this, I would also like to thank the back support team that has helped bring all of us together for this live YouTube session today. Thank you, my support team, for all of this and for
एग्जाम्पल लेना
getting all of
आधा
us
फिर तू दोबारा
together
पढ़
for
दे।
this good discussion, for this moment together. So, three cheers
Out
to
of
you.
two pairs.
ये
Yes.
जब मैं गाड़ी चलाता हूँ
Yeah.
ना, चलती गाड़ी से
Yes.
कूद जाता है ये।
No,
Okay.
but there are a lot of students, and your
तो
selection and your
अरे
words, they just
हथियारी।
actually motivate the rest of the students. Whatever I say,
ये
Dr.
तुम्हारे
Snigdha
ईस्ट यूपी
say,
नहीं है,
they
वेस्ट
take
यूपी
it.
है,
But when it
मुजफ्फरनगर।
comes from you
गाड़ी
people,
चलती है
those who have
ईस्ट यूपी
actually
वाली।
made it, it makes a very big difference. So coming from you all,
चलती है
it's
देहरादून
going
वाली।
to be really helpful. So thank you all of you, and
तो भाई मैं
just
भी मेरे पास
congratulations
आ
for
जाओ,
your
देखना
success
बिजनौर से
and
आ
keep
जाऊँ मैं,
scoring high.
खंडवा से आ
And
जाऊँ।
I'm sure that you guys will be just
घर है
going
हमारा।
further with the rest of the sessions and
घर है
part
हमारा।
two preparation. And very soon you all will be in Australia.
Hope
इसलिए
to
तो कह रहा
see
हूँ,
you with
दादा
us for the
दादा
part two
बिजनौर।
preparation.
दादा भी तो बिजनौर से ही
Yeah.
है, वही में
Let me know
Thank
that.
you.
रहते थे मुंबई।
Okay.
Okay.
Thank you, everyone. Thank you for the session. Congratulations once again.
Thank you.
Thank you and many
Thank you.
congratulations.
नहीं भाई।
Bye.
वाओ।